Good evening, everyone, and welcome. My name is Louise Hickson. I'm the Associate Dean External Engagement for the Faculty of Health and Behavioural Sciences at the University of Queensland, and I'm delighted to welcome you here this evening. I'll begin, as we always do, by acknowledging the traditional owners and their custodianship of the lands on which we meet today. And on behalf of the University of Queensland, and in particular the School of Dentistry, I pay our respects to their ancestors and their descendants, who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. Tonight we are delighted you're able to join us either in person, as you are here in the room, or via Zoom, and we have many people on Zoom, for the launch of the Centre for Orofacial Regeneration, Reconstruction and Rehabilitation, henceforth to be known as COR3. Yay! Make a special mention of our esteemed colleagues and partners who have travelled interstate for our special event this evening. This groundbreaking centre will act as a vehicle to facilitate interaction between researchers, clinicians, patients and industry partners. Such partnerships are central to the success of the University of Queensland. It is partnerships like this that have seen us rise to being one of the top 50 universities of the world. COR3 is a fabulous example of what UQ has been doing and what it wants to do more of. The School of Dentistry is fortunate to have an incredibly strong network of philanthropic donors from alumni who have enabled us to remain at the forefront of the field. And tonight is another opportunity to thank you so much for your support. The School of Dentistry is also no stranger to partnering with industry stakeholders to achieve great things. And one notable way this has been exemplified has been through the Oral Health Alliance between the University of Queensland and the Metro North Hospital and Health Service. The Oral Health Alliance is a generational opportunity realised, uniting the clinical treatment capabilities of the health sector with the dental education and research capabilities of the School of Dentistry right here in the Oral Health Centre, which is the hub of the Oral Health Alliance. Importantly, we also take the opportunity this evening to celebrate the appointment of our new head of the School of Dentistry, Professor Sasha Ivanovsky. Sasha will be known to many of you in the room. However, this launch represents the first opportunity we've had to gather our colleagues, industry partners, alumni and donors together since his appointment commenced in January this year. It now gives me great pleasure to welcome Sasha to come forward as he also again officially launches COR3. Welcome, Sasha.
Thank you, Louise, for that very nice introduction. And thank you, everyone, for coming tonight. Thank you for taking time on your Wednesday evening and joining us. It's really actually refreshing to see a room full of people. We're not seeing that much these days. Usually looking at a screen mostly and people on the other side who may or may not be paying attention. You will all, of course, be paying attention today, right? No, look, it's really an exciting time for us, and by us I mean all the people that have been involved in this centre, and there is a number of people, many of whom you will hear from today. It's some time in the making, and probably a good year delayed from when we originally wanted to do this, but that's the times we live in. And as Louise said, from when we conceived the centre, things have changed, and now I'm head of school. So I want to start actually by telling you a little bit about the school, and I think it's important to put the role of the centre in the context of the school as a whole. So some of you have had a chance to look around the facility today. Many of you have been with us previously and visited the facility. You'll all agree, I think, that it's a magnificent facility. It's almost unprecedented in scale and I guess size and to some extent opulence for a dental school. But we're very happy to be in this facility. But of course, it's the people inside the place that make the place what it is. But it doesn't hurt to have a very nice facility. So there's some information about the school. It's $140 million building, built in early 2010s, opened in 2015. 170 chairs across 11 clinics, so it's a big operation. Lots of teaching spaces, simulation labs, a PC2 lab on site. And we teach an undergraduate program in dentistry, a Bachelor of Dental Science, honors program, Deakin Dent, so specialist trainees in a number of different disciplines. We do CPD and we have research students. We also, as a school, run 2 rural clinics in St. George and Dalby. So this is how the school's research is structured. There is 2 major themes where we have substantial critical mass of expertise. So that's COR3, for which I'll be talking to you today, and also our dental public health unit, which is headed by Professor Lockdoe, who's just joined us this year and comes with substantial expertise, funding with 3 NHMRC grants. Actually, Locke is back there. Hello, Locke, I was looking for you. Say hello. So we are really, really happy and to have probably the leading, or I'd say definitely the leading public health researcher, public dental health researcher in Australia with us. So those are the 2 main themes. And then we have clinical research units focused on the activities of each of our disciplines. And they interact with the centers as needed. So that's how we are structured at the moment. As we bring more expertise online, that might change. But it's reasonably compact, focused, but with plenty of scope to grow. And those 2 main themes have got multiple layers, as you'll see now with the COR3 facility. So we really got one side that focuses on epidemiology, prevention, and other side very much around intervention. So why these 3? Regeneration, reconstruction, rehabilitation. It's all a bit of a mouthful. Well, I think this really captures a lot of what we do in, I guess, what you'd call interventional dentistry. And also where the future of dentistry lies in the context of treatment. Ideally, we would prevent all disease and never have to rely on any of these. But that's really, we know, unrealistic at this stage. And with an aging population, people keeping their teeth for longer, there is more and more need for interventions, and there is more and more need for innovation in these areas where there's clearly an unmet need. So what are we trying to do? What is this center about? It's about these 4 components. It's things we've been doing for a very, very long time. The activities are not new per se. It's rolling all of these activities under one umbrella so that there is synergy internally and externally. Okay, so it's synergy for us as a team to understand all of this, how all of these components come together towards a common goal or aim. And it's also the ability to showcase our abilities externally, so people understand what all of the different things that we do, how they all come together. So research, education, translation, and collaboration. These are the things we do. This is a snapshot of the team. Currently, there is 3 professors, 6 academic staff, 8 full-time research fellows, and 2 research assistants in the team, 13 HDR students and growing rapidly, and a large number of Deakin Dent and undergraduate students. It's an active group. We've, over the last 4 years, we've published over 200 papers, more than 10,000 citations, and more than $5 million in research funding from various sources. So this gives you some idea about the scale of what we're doing in the center. Our facilities are centered around the things that you can see around us, right? So the clinic and the operating theaters, the teaching rooms, the preclinical teaching lab, these are all used for research and training and education. We're very lucky to have a state-of-the-art PC2 lab with OGTR certification. So we don't have absolutely everything you'd want in a lab, but for a lab within a dental school, again, it's a precedent in its capabilities, especially the specialized equipment that drives the research that we do in those areas: biofabrication, bioengineering, around regeneration, reconstruction, rehabilitation. We are very, very lucky to be in this precinct. So what we don't have on site, we can get very close around us. And we can, and so this is a huge advantage. So there is little old us there. There's the medical school. That's the Hurston Health Precinct, right? So more than 30 health facilities, institutes, university departments and schools and organizations. More than 13,000 people work within this precinct. You got the Royal Brisbane and Women's Hospital, Queensland Institute of Medical Research, the UQ Centre for Clinical Research, the new STARS building that's just around the corner. If anyone needs a Pfizer vaccine, go there. Anyone can get it. I'm not kidding, as all the postdocs and students found out the other day. So that's a surgical training and rehabilitation sciences building. Hurston Biofabrication Institute, which I'll talk more about soon, and the UQ Schools of Medicine and Public Health. So here, the important thing to note about this centre, it's all about innovation. So we are very lucky that a large component of our research capability, the people we have, are all early career researchers, highly motivated researchers that you'll meet soon, that are driving innovation that leads to real clinical outcomes. These are our capabilities in biofabrication, 3D printing, multi-lecture writing, and a whole suite of other related scientific disciplines that are essential for the type of work we do. But you'll agree, for a dental school, that's a lot of capability on site. And it's you know, and what we don't have, as I said, we can still get in our immediate vicinity, but it's also very nice to have this capability and be in full control of our resources. So the ultimate aim is to have real outcomes for patients. So clinical translation, and the clinical translation occurs through the Oral Health Alliance. So Louise has already talked about the Alliance. It's a very important part of what the school does. This is as Louise said, really a generational opportunity to combine the capabilities of two substantial organizations to mutual benefit for both people working within the organizations, for our students, and most importantly, for our patients. So there's three related and synergistic missions: that to provide the community with timely and effective state-of-the-art dental care services. I added that state-of-the-art bit, by the way, so it's very important, I think. Then train the next generation of dental professionals and upskill the current workforce with advanced training opportunities, and conduct research and disseminate the outcomes to clinicians, policymakers, and the public. And I think the thing that the centre does, the activities of the centre, really align perfectly with the Alliance. Our education is very important to us. So our structured programs, which we hope to grow, are all about integrating innovation throughout the curriculum. And many of you that went on the tour will understand that we have a lot of the toolbox necessary to achieve that. But we always have a mind to innovation and how we can improve the experience for our students. Continuing professional development is essential for us in terms of interacting with the profession. So we aim to run high-level, high-quality CPD. I think this is an area that generally within Australia, I think universities have fallen over on. I think there's been the CPD landscape has got very murky with a whole variety of different providers and quality of CPD, I think it's our responsibility to make sure that we provide quality CPD to the profession. There is a big gap between the programs that we have. We have an undergraduate program that leads to qualifications as a dentist, postgraduate programs that lead to specialization, and a big gap in between that we will fill, and the center will be central to that. We are very fortunate to now be partnering with the Hurston Biofabrication Institute. So this is a Metro North facility that's in partnership with UQ as the academic partner, and the school and the center has been now fortunate to be successful with a grant application to be one of the programs within the center. So together with the oral maxillofacial unit and Associate Professor Batstone, I know he's here somewhere, is leading this program, is really a huge opportunity for us to move from the oral dental space also to the craniofacial regeneration space. It's highly synergistic. So we are very fortunate to be working with clinicians from the oral maxillofacial unit in this project, which is very well funded, as you can see there, over the next 5 years. We have partners and collaborators from around the world. So we have, and the postdocs and group leads will elaborate on this. We have local, national, and international partners. We partner with professional bodies who directly support our activities, many other bodies who indirectly support us as well. Industry partners, most of whom are here, and thank you for coming, most of them coming from interstate to join us, and practice networks. We work together with a number of private practitioners for our research and clinical research in particular. So very quickly here, I'll talk to you about the genesis of the center, I guess, which is quite oddly named Ivanovsky Tissue Engineering and Additive Manufacturing team that's now grown into the center. So the way that the center is structured is that many of the postdocs who have been with me now from 5 to 10 years have really grown in expertise, in capacity to the stage where they can run their own programs. And this is what the center is now trying to achieve, is to give the opportunity for these young, dynamic researchers, from whom you'll hear from in a minute, to run their own groups. The theme of the center, or a big focus of the group that originally started, was this idea of combining different aspects of fourth industrial revolution technologies, digital technologies, to get superior outcomes for our patients. So this is just a little bit about the research that was the genesis, I guess, of the center, and as an example of what the center is aiming to achieve, but on a much larger scale now. So combining digital imaging with additive manufacturing, advanced regenerative techniques for personalized or customized regenerative dentistry outcomes. So this is some of the workflow that we use to make these personalized constructs, which are very unique and offer unprecedented levels of treatment options for patients. So the idea is, as you saw before, that was a CT scan, and the CT scan was used to create the defect and identify the defect. We then import that into a CAD software, where then we build the reconstructed tissue. So we design the reconstructed tissue digitally. So there is a periodontal defect, but this is very applicable to other types of bone defects. As you well know, there is a large scope here in terms of unmet need in treating complex bone and periodontal defects. This is the design, the scaffold itself. And the very important point here is this is a highly porous structure, essential for vascularization, and totally different from conventional 3D printing, which tends to be solid structures. So the fact that this is highly porous is really a key component of the strategy, and designing those is far from trivial. While there is plenty of design software to design solid structures, controlling the porosity is a different matter altogether. And finally, here is the printer in action. So the printing, again, it's far from a simple process. And what you saw there as a first step in making these complex structures is a support material. For complex structures, you have to have a support material in order to have layer by layer building of your complex structure. Now, that support material eventually dissolves, leaving your complex structure. But complex structures with overhangs cannot just be printed in thin air. They need a support material as well. So with that, I'll finish up my presentation. I guess the take-home message here is the type of work that we want to build here, which has impact on education, on translation, on research innovation, is not straightforward. And it takes something like a center like this to bring together all of the expertise that we've been building over 10 to 15 years in order to really push forward to meet the full potential in this area. And we look forward to continuing to collaborate with many of you to achieve our ultimate goal of unique and revolutionary solutions for our patients. So on that note, I will now hand over to some of our postdocs. They'll give 2 to 3 minute oversight of their various projects. So first off the bat is Ali. Ali is a postdoctoral fellow at the school. He's been working now with me for about 5 years. Before that, he's worked all over the world, Latin America, I think in Korea, and brings a lot of biofabrication and biomaterials expertise to the team, especially in the area of metal composites. So over to you, Ali.
Thanks, Professor Ivanisky, and thanks everyone really for coming. It's a pleasure of mine really to give just like a quick introduction about really my group, Ali Group for Biodegradable and Biofunctional Biomaterials. Actually, so this group, actually we are focusing on developing a new advanced biomaterial scaffold with multifunctional properties. I worked really with this is a group recently established. So before I worked, all my PhD was on biodegradable metals. I really have done a good achievement and the progressing of developing magnesiums and its alloys and how can control its biocompatibility and adding multifunctional properties for magnesiums and its alloys. So recently we started luckily with biofabrication with a Harrison of biofabrication and with Professor Martin as Professor Ivaniscu elaborated really very well about that. So we are working in developing a new biodegradable metal implants to replace conventional titanium alloys. So we have really a broad experience here on additive manufacturing, wide characteristic of biomaterials, biodegradable metallic implants really, and biodegradable polymers and their composite for electrochemical corrosion to do analysis and measuring the corrosion rate or degradation rate in a quick way of biodegradable metals. So the challenge is really about using biodegradable metals. We are really the first group to start how can build a biodegradable metals mesh to replace the conventional titaniums. It's titanium Ti64 alloy for vertical bone augmentations. So my research group, really, I'm waiting for 3 doctors to visit. They already received their own grants from their country. All of them, the Dr. Su and Yon and Nasser as well, got 1 year supported from his country. Hope soon will join our group and the 3 master students. So what we've done really so far here is really deposition in perfect fashion actually of apatite-like or hydroxyapatite on each single electrospun nanofiber using hydrothermal techniques. And really this will recognize it in chemical engineering journals is double impact factor. And then about hydrothermal treatment, we could really use this technique to provide a good ductility and also serves with ability for PLA because it's well known, it's brittle materials and has low hydrophilic properties. So formation or deposition of biocompatible FDA approval materials on each single electrospun nanofiber really has been done in our research group as well. So air-jet spinning really, this is just to, as alternative technique to produce micro nanofibers in a high fabrication rates compared to the conventional electrospinning techniques. In just a few minutes, you can collect about what it's been used for. Electrospinning takes hours or days. In this one, just in a few minutes. So luckily, really, we recently developed a new patent, Australian patent about this incorporation of apatite-like or hydroxyapatites that is really essential for accelerating the bone formations in ultra-uniform dispersion within the within the 3D printed BCL scaffold. Also recently developed magnesium hydroxide as a source of osteogenic materials, replacing magnesium as magnesium can release hydrogen gas, and this really recently published. And we're the first group to incorporate hydroxyapatite nanoparticles within the melt electrowriting BCL scaffold. So we are very proud. SciVal showed above 90% of our really outputs published paper of own collaboration. We are really collaborating nationally and internationally. 5, really, we didn't find enough space to really allocate the rest. So really, we are very proud. We are doing really good achievement, collaboration with Germany, China, Japan, Latin America, and really USA as well. We are collaborating with Shrek and also Nadi as well there. So our work recognized in different social medias, and we are really welcome everyone who is here. We can see him and who is really watching us online for welcome for collaboration. We have very strong facilities. We have really well-established teams, and thank you very much for listening for that. Thank you.
Sit on the stage here, and then you'll be available to answer questions next. Okay, our next speaker is Dr. Karan Gulati. Karan is an NHMRC Early Career Research Fellow, so people in the game will realize how difficult it is to get one of those fellows. We actually have 2 here tonight. Very fortunate to have someone of his expertise and quality with us. So I'll let you share your research with us, Karan. Thank you.
Thanks, Prof. Good evening, everyone. My name is Karan Gulati, and I'm the leader for the group called GATORS. It's a fancy name, but it really stands for a group for anodized therapies for osseointegration, regeneration, and stimulation. So what we do is we perform nanoengineering of dental implants. We fabricate controlled nanotopographies on different metals, alloys, more popular including titanium and its alloys, zirconium and its alloys. But we can really extend the technology into any metal or alloy. The focus is to fabricate these nanostructures and then achieve local drug release. So these nanostructures are like empty test tubes, can be loaded in theory with any drug, protein, or growth factor, which will then be eluted directly inside the dental microenvironment. Because they are nano rough, they promote the activity of cells such as gingival fibroblasts towards soft tissue integration, osteoblasts towards osseointegration. We use a simple and cost-effective technique called electrochemical anodization, and we can fabricate controlled nanotopographies as you see on the slide. The idea here is that the arrangement of the nanotopography, the size, geometry, chemistry, topography, everything can be controlled. And based on that, we can mechanically stimulate cells and control the bioactivity of cells. What we want is the enhanced functions of gingival fibroblast towards soft tissue integration, as I just mentioned, enhanced functions of osteoblast towards osseointegration, and finding a sweet spot towards immunomodulation. Do note that these empty nanostructures can be loaded with antibiotics so that you can have months of local antibiotic therapy directly inside the dental microenvironment. We have expertise in electrochemical surface modification. We can control the topography, chemistry, and the drug release directly inside the dental microenvironment. What we design are fit and forget dental implants. We are actively looking for collaboration towards infection models in vivo, towards cytotoxicity evaluations, towards modeling the drug release directly inside the bone microenvironment. Thank you.
I'll just get you to step over. Okay, our next speaker is Dr. Ping Han. Ping Han has now been with us for the past 3 years. And but before that, actually, Ping was one of my PhD students at QT, going back some time, before getting also a UQ Development Fellowship and spending his time with Professor Justin Cooper-White, who I think is also here. So she came very well prepared and very well trained, and has been very instrumental in setting up this area of nanodiagnostics within the group. So hand over to you, Ping.
Thank you, Prof, for the introduction. So my name is Ping Han, and my group is working on epigenetics, nanodiagnosis, and nanotherapeutics. So there are two main themes. One is using the exosome as nanodiagnostic markers, and the second theme will be as cell-free therapeutic for oral disease, especially for periodontitis. And the third theme is what I learned from Professor Cooper-White's group, which is cellular mechanics on different substrates. So for the exosome, it's very interesting. It's basically just our mini copy of our cells. Basically, it's smaller than 200 nanometers. However, it carries every information what our cells have, including the SARS-CoV-2 virus or some other MERS and everything else. And our research, first of the theme will be the nano biomarker. So at the moment, our research is focusing on trying to finding which marker can be the potential one to diagnose our periodontal disease. So basically, you just spit your saliva out, and then we isolate your nanoparticles, which is called exosome. And then we find a panel of marker, and then we can tell you are healthy or gingivitis or periodontitis. However, this is the whole idea of the project. We are still on the way of it. But so far, we have developed our own column, which can isolate highly pure population for exosome, which is very critical in the field. Once we have our in-house SEC column to isolate exosome, then we can use this exosome into our cells, and we should see whether it can promote osteogenic or other cementogenic differentiation. And at the same time, like I said, I learned from Professor Cooper-White's group, which is cell mechanics. And I was lucky to publish with Professor Cooper-White on SCS Nano anyway. So we bought one equipment which can do this project. And this is the only one in Kirsten campus. So anyone who wants to do some transfection in the cells, please contact us. And like I said, for our diagnosis project, we ideally, if you give us your sample, we can tell you which health status you have. So far, we found that exosome DNA methylation and also exosome MERS are potential biomarkers, but we're still searching for other potential markers. In the end, we are going to put them all together as a panel, we hope which can help diagnose the disease. Other than these main themes, we also do some fancy aerosols and droplets, especially for this COVID-19 period. So, and we realized that different dental equipment or dental procedures can generate a lot of aerosol and spatters contamination. And we are trying our best to see which strategy which can prevent this. And to be mentioned that some of our research has been cited in the news or media, and especially one of our papers are cited by the Colgate website and another American white paper. Last one. I was very lucky to collaborate with our collaborators, especially our COR3 Center Director, Professor Ivanovsky, and also Professor Bartold and Professor Laurie Walsh, and also some other UQ researchers. We have more than this, but I just put a few, not limited to these collaborators, especially Carlos and also Xiang and Wei, who told me the sequencing and others. Thank you.
Next up, we have Professor Ove Peters. So Ove is actually a recent addition to the school and a very, very welcome one. A very high profile recruitment for us. He's probably one of the, well, definitely one of the most eminent endodontists in the world. A fantastic clinician and educator, but also one of the most published and cited endodontists. So great to have you on board, Ove, and maybe tell us a little bit about your research. Thank you.
Thank you. Thank you, Sergio. Well, it's interesting for me to look at all the periodontic content, right? I'm kind of the natural enemy of this group, but I feel very welcome, and I must appreciate not only that you're letting me have a part in this COR3 Center, but also certainly for all of you to be here and be interested in a couple of things that we can share. As we said, you know, not everything is at the situation where a tooth has to be removed. Sometimes, more often than not, we try to retain teeth, and you said this very, very nicely, and I appreciate that. So our theme in my group, that includes 2 group members that sit here and quite a few others, as we will see in a second, is to improve oral health by therapies that maintain and rebuild healthy tissue compartments. When you're talking about the endodontium, it could be the dental pulp or the periapical tissues, both of which are essential in a healthy state to maintain the natural dentition. So we do a lot of different things, and I have done this over the years in my previous position in San Francisco and also before that at Zurich Dental School. And a couple of technologies that we have used are in the field of cell biology. Without going into too much detail, I was almost very interested in the degradation of biomaterials, and I will expand on that a little bit more. What you see here is one of the papers that are highly cited, and this is actually almost like 1,000 citations in the meanwhile. But the fact of the matter is, only in a collaboration, and I look forward to seeing more of, and a couple of people that sit here have already pledged to work with me, so that's very good. Let's take a look at details. I've been given 3 minutes, and I want to make sure that I don't overstay my welcome. A couple of pieces of information are important. 2 elements of my research are really to be highlighted, and one of which is vital pulp therapy, and the other is micro-invasive, I wouldn't call it minimal invasive root canal treatment. So a couple of snapshots are in the bottom here, one of which is the apical papilla formation. That's the growth center of teeth that gives us access to a molecular laboratory of cells that can be used to simulate a couple of things in the condition of pulpal breakdown. I mentioned vital pulp therapy. It's interesting that the convergence of different things is visible also already in the minutes that we've spent with each other. And the name of the game is immunomodulation. Harnessing the regenerative potential that already exists in the tissue compartment and making sure that there is an environment that leads to predictable, not repair, but restitution of function. And this is part of a study that I did with my collaborator, Alexis Gaudin in France. And we are showing here for the first time that the lipoxin receptor is actually constitutively expressed in apical papilla cells. Why is lipoxin important? This is a signal that has been shown to drive a repair process away from a repair with a scar to a functional repair. Why am I highlighting this? We in dentistry are really looking at a relatively small compartment, but this is important, very much more so in the big medicine. So think of pulpal injury, the injury to the dental nerve, if you will, as a reperfusion injury of sorts. There is a segment that is no longer functional, but needs to become functional for the dental pulp to work. Make the big step to a stroke, where exactly the same happens. Portions of the brain are no longer perfused, and now we have to rebuild this to function. Nobody is helped after a stroke with a scar. So, and Lipoxan has been shown to do exactly that in, for instance, like I said, stroke, but also myocardial infarction. Very interesting properties. The other larger research theme that I'm following, and I have done this also for many years, is what happens if you cannot maintain a vital pulp. So we have to increase the ability of performing root canal treatments. This is just a couple of technologies. And if you look closely, this device that is in the center here is now in the lab here. It's almost historic. It has served me well. Nobody else has one of those. We've developed root canal instruments. We're looking into finite element technology to understand what these instruments do and also what root canal treated teeth do. This is in the shortness of time, just a snapshot, but to maintain what I said before, really have to think of not necessarily prevention, but to make sure that in the career of a tooth, in the career of a person that's attached to the tooth, we can do the best to maintain oral health and overall health. As I mentioned before, we do this in collaboration. This is just a snapshot of a couple of groups that I work with. My main collaborators are in Nantes in France, Alexis, in Madrid, and certainly in some other locations that I mentioned here. My right-hand person from San Francisco has just moved to the Eastman, which is rekindling some of your memories. And with that, I want to close this off by, again, thanking you all. We're happy to entertain any questions. Looking forward to potential collaborations inside and outside of the lab. Thank you.
Thank you very much, Ove. Next, we'll hear from Dr. Ryan Lee. Ryan is now the discipline lead in periodontics. And I've been working with Ryan probably for a good 10 years now. And actually, there is a UCL connection here because Ryan did his periodontics training at the Eastman. So small world, right? So Ryan is kind of the coordinator of the clinical research unit and responsible for trying to bring all the clinical research interaction with the center. So you'll tell us a little bit about some of the projects that are going on in this space. Thank you, Ryan.
Actually, today I actually learned a lot, especially Ove. I mean, there was a research interest I never thought about, but there is an immunomodulation you're doing. We need to talk more about that. Anyway, I'm not going to talk about too much about my research interest, but I would like to introduce this clinical research unit, what we do in this clinical research unit. As you've seen, there has been exciting research going on, all the aforementioned research. They are at the moment very early stage, and then eventually they had to come to a clinical setting. And that's when the clinical research unit comes into play. The whole idea, the mission of the clinical research unit is to facilitate the clinical and translational research aiming to improve the care of patients with oral and dental diseases throughout new diagnostics and therapeutics. All the things we have mentioned from implant dentistry to perio, these particular area, I have a major interest, and then we can definitely develop on this through this clinical research unit. Obviously, we have a very privileged to have all the different disciplines working in this building, and with the good collaboration with the Metro North, we have enough patient pool. That gives us a very strong privilege, and that's very strong position to conduct this type of research, especially cutting edge technology. We can implement it, and then we can improve the current understanding and then therapeutic guidelines. So our facility, we already mentioned, Prof. Ivanovsky, and then we already mentioned about our facility, but our main facility will be located at 6.3. Some of you did a little bit of a touring. That particular facility was the postgraduate training area, but opposite to that, we do have a dedicated research unit space we'll be using to conduct this type of research. With the help with the Metro North, because a good collaboration, this is one of the good example of a good partnership between Metro North and UQ, and that's going to give us the actual boost to conduct this type of research. Obviously, we have multiple people involved in this one, but the major workforce will be our declined students and students. Every day we collect tons of information and from patients, and those information, if we don't utilize it, obviously they will go waste. For that reason, we have recently developed, we put time and money to develop such a program or software within Metro North system. So every time we collect the information, those information will be stored in the hub and the Metro North hub and the central unit, and then we can go back and then retrieve those data, and then we can see long-term outcomes of the treatment we have provided, or even prospective study we can design. And then that's the main aim of our facility and our mission for this particular clinical research unit. Besides that, I have a major interest in periodontics. I'm a periodontist, I'm a clinician, at the same time researcher. So basic science, especially in the immunomodulation in diabetic patients. And again, there's a project hopefully coming very soon with the Metro North. There is a diabetic patient, we can get them in our hospital while they're seen by the other specialists in immunologists. They can be here and we can collect the other information and then see what actually changes in these people and how they can improve our diagnostic and prognostic in the future. Thank you so much.
Thank you, Ryan. So our next speaker is Dr. Cedric Vaquette. So Cedric is probably the longest standing and most senior of our postdocs. I've been working now with Cedric for about 12 years. So he's an infinite amount of knowledge that everyone in the group draws upon. And he'll share now some of his research interests, which kind of have grown to quite a wide range over the past 12 years. So we'll try to keep that to 3 minutes, Cedric, right? Lots going on. Thank you.
Thanks, Sasha. Good evening, everybody. So my name is Cedric Vaquette, and I'm leading the group of biomanufacturing and regenerative dentistry. So our group is actually trying to address some of the major limitations of regenerative dentistry, and we are particularly interested in trying to treat periodontitis and also bone deficiencies, but most particularly vertical bone augmentation. So these are the main two topics that we are researching, and hopefully I will convince you that we have made very good progress. And on the side, we have also developed a research interest in orthopedics, because that's where I'm sort of coming from my PhD training. So I like to keep that, so tendon and ligament. So in our group, we are actually using additive manufacturing, such as 3D printing and melt electrospinning writing. For those that have actually come and toured the lab, you've seen those equipment while they were working. So this is actually our main fabrication technologies for developing scaffolds or implants that we can hopefully translate into the clinic and use on patients so that we can improve their health. So the first major topic that we are researching is actually trying to develop a scaffold that can address periodontal regeneration. So I'm not going to talk about the disease, because most of you are actually clinicians, so it will be a little bit of my place to do that. But central to this treatment, what we have been developing is actually the concept of a biphasic scaffold. So we have realized that you need some sort of a compartmentalized regeneration so that grown bone can grow, but also the soft tissue, the periodontal ligament, can grow and attach to the root surface. And this is what we have been doing with fiber guiding scaffold. And you can see here an image. And those little bits toward the bottom of the image are actually channels that are 60 to 100 microns in width, and they are actually aligning the cells perpendicular to the root surface so that you achieve an attachment that is relatively similar to the native tissue. The other major topic in my group is actually vertical bone augmentation. And there we are actually using 3D printing to create scaffolds or construct that are actually have a high space maintenance properties so that bone can grow and bone can remain. So one of the major advancements that we have actually done is we have grown bone in those scaffolds, and thereafter, once bone has been grown, we re-enter the animal and place a dental implant. And what we have actually observed is when we have the scaffold, which is biodegradable, but it takes about 3 years to degrade, bone stays at the same level. Sometimes it even increases in height. When we don't have the scaffold, so just an hydrogel where bone has formed, the bone is completely gone, has completely resolved within 8 weeks. So this is one of our exciting research topics. And we are also interested in printing hydrogels with bioceramics, and this is a collaboration with Geislicht, where we have actually printed a very high content hydrogel, a very high content bioearth into an hydrogel. And this image is actually to show you how resilient is the scaffold. You can really compress it and it comes back to its original shape. And that's it for me, so thanks very much.
Okay, thank you very much, Cedric. And now, finally, last but certainly not least, we have Chun Zhu. Now, Chun has just recently returned from overseas, back to the school, and Chun is the other NHMRC fellow. So he's in the final year of his fellowship. As part of his fellowship, he spent 2 years overseas. He was actually in UCLA and Stanford. You know, I think we all recognize those institutions. Probably not the best time to be traveling around the world, but he learned a lot over there, and I'm very, very grateful that he's now back at the school, bringing all of this expertise and knowledge back to the school. And he's studying this very, very interesting area of nanoparticles, which he'll tell us all about right now. Thank you.
Good evening, everyone. My name is Chen, and my research interest is about the nanomaterials for biomedical applications. As we know, when we fabricate materials at the nanoscales, it shows some unique physical, chemical, and biological properties. So we are utilize those properties to address some challenges in clinical practice and also in basic research. And as shown image here, I'm synthesizing some nanoparticles that can be used for drug delivery or tissue engineering. And I'm going to tell you some stories of my previous research. So first thing is that with some advanced techniques such as electron tomograph, we can have a close look into these nanoparticles. And those particles are quite tiny. The scale by is 100 nanometers. So with those unique technique, we can design and synthesize those nanoparticles as we need it. And the first application is called nanotherapy for joint. As we know, temporomandibular joint disorder is quite common in clinics. And the people who have those temporomandibular joint disorder, or called TMD, were suffering from like pain or difficulties in eating and talking. And currently, hyaluronic acid injection therapy is a common one for the treatment, for the management of TMD. However, for those kind of injections, we need to multi-injections because hyaluronic acid will degrade very fast. And those multi-injection is painful and inconvenient. So we developed a nanotherapy by using those nanoparticles to deliver an enzyme which will trigger the body itself to synthesize those endogenous hyaluronic acid in the joint. And those with only one injection, those therapy or those synthesized endogenous hyaluronic acid can last for 3 months. And this will help for the bone repairing and also reduce the symptoms. This work has been published in Advanced Materials, one of the top journals in the material science, and selected as a cover. Another thing is that the second one is called the nanosegment for bone repairing. As we know, scaffolds are quite widely used for bone repairing. However, if we want to achieve a better outcome, we need to consider that the body reactions, that's called immune response, and also we would like to promote the bone repairing. So with those nanomaterials, we can turn the composition and also morphology of these particles and make them injectable. So with those nanosegments, it can reduce the body inflammation and promote the self-bone repairing. And this work also highlighted as a cover story of nano research. And we also fabricate some nanofibers that entrap some nanoparticles that can sustain the release and growth factors, that is some Q or some other drugs that can be used for periodontal regeneration. Compared to commercially used GTR membranes, such as BioGuide membranes, our membranes shows even better regeneration ability. And the last story I would like to talk is about the nanoparticles that can be used for biofilm treatment. So as we know, biofilms has more drug resistant due to they are forming some extracellular matrix, and they are resistant to some antibiotics. With those nanoparticles, they can penetrate into these biofilms and release the drugs inside, which shows better performance compared to traditional drugs. And our work has been highlighted, in addition to what is cited by the researchers, our work is also highlighted by some social media, such as Twitter, Facebook, also by some like 7 News. And thank you all, that's all from my staff. Thank you.
Thank you. Thank you, Chun. So I think you'll agree that there is a lot of very exciting research, very diverse research, very cutting edge research going on at the center. And certainly the center is very, very good hands with this research leads leading all our activities. So before we head off for drinks, I think this is our opportunity, since everyone's been sitting here patiently, to ask some questions. You have to ask some questions. Look at them. They're right there waiting for questions.
I'll just bring the microphone in, so I'll just give one to the researchers.
That's just there.
So we've just got people online, so that.
Hi, my name is Jess Marr. I'm a group leader at AIBN. So it's incredible to look at the breadth of research that's here. I'm wondering, because you're here with access to a patient population, how much does that population influence the research questions that you decide to focus on? I see a lot of amazing innovative materials and drug delivery and all that sort of thing, but how much does like the patient problem that you see influence those research questions? That's to anyone who wants to take that question.
Uwe, that's for you, Ryan.
That's a really good question, because at the end of the day, whether we can really apply this amazing technology to our population. So the population we normally see here, the reason I said it, we are in very good position because we have an aging population. People who come actually here is either low socioeconomic or retired. So they are the Queensland Health eligible patients, and they do have lots of issues, not just the case, but they have a lot of neglected mouth. And then obviously when we do the rehabilitation, all these particular technologies will be very, very useful. All the technology we have mentioned today, it's all relevant. And then the clinical research unit, we're trying to capture all this technology and then implement into the clinical research so that actually we can get some meaningful end results. And that will be our mission. But we are, by having this particular collaboration with the Metro North, that gives an extra boost for clinical research. And then the just amount of patients coming in here is just a major advantage, having this particular center at this institute.
So if I can just add two things from that. So I happen to be also the academic director of the Oral Health Alliance. And we haven't mentioned the fact that we have public health research also going on here. So we really do have a good perspective of what is the need of the population at large. And for instance, from my perspective, vital pulse therapy is certainly something that can be applicable in a large number of cases that conventionally now are being sent to a root canal treatment. And these are patients that can either not afford a root canal treatment, teeth will be extracted, right? So we are at the interface of not only what's happening here, but also what happens at placement out in the community. And I see Dr. Brown here, so it's really interesting to have a sense of what is it what the population at large needs here and also outside of this building.
And I'll just add a couple of more points to that. Jess, is actually a very, very good question, which we didn't really cover that much in the presentation. So there's no doubt there's a lot of discovery science going on, and that's always a driver for grants, for high quality publications. But we've also invested very heavily in meeting regulatory requirements for translation of our research, very heavily in this. So we're very much focused on working with in the research that's focused on direct translation now or imminently. We're very much focused on working with medical grade materials, usually materials that have been used in other platforms. We collaborate very closely with my friend Dietmar Hoedmaker here, a very close collaborator who's got quite a bit of experience with translation. We're working on building a quite substantial platform around quality management systems, data files for products and even meeting ISO requirements. We're actually having an audit in about a month for that. So we've got about 3 or 4 people working in this space. We didn't really focus that much because actually it's kind of not that exciting, but exceptionally important work that's done in the background. So definitely regulatory requirements for translation is a big focus for us. Is there a question?
Hello, how are you going? My question's for Ping, about the exosomes. I'm not by any means a researcher or anything like that, but I just couldn't believe it. I just saw this video yesterday about exosome isolation, a novel, rapid, scalable exosome isolation technology. It's been presented today at the Virtual International Society for Extravesical annual meeting. And then I'd seen this presentation also that University of Queensland had a machine. Are you using that, Exonet?
Thanks for your question. So for the EV isolation, there are different methods. The SEC method is basically just one of it. And our collaborator Colors is working on this as well. So we actually in Brisbane, there are around 4 or 5 labs who are doing EVA research, based on my knowledge. And different labs, including my PhD supervisor Ian's group. So our group and the Colors group, we're using our in-house developed SEC columns, which compared to the gold standard ultracentrifuge, ultracentrifuge takes 12 hours-ish for the whole process. But for this SEC itself, it only takes 30 minutes. So it's a very quick protocol and very easy to control and get pure population as well.
Because that makes it something that actually can be usable.
Yeah.
Because you can quickly get it rather than being a fraught process. But yeah, this one was 15 minutes, so it's good to know that then it's made.
Got to cut another 15 minutes out, Ping.
Okay. Include some other preparation in 15 minutes.
I mean, this is a really good example of us working with other people within this precinct. So Carlos is a NHMRC fellow from UQCCR and an expert, absolute world leader in exosomes. I mean, obviously he is not specifically interested in periodontics, so we bring the clinical focus and then he helps us with all his infrastructure. Yeah, absolutely. So I guess we're all standing between you and having some drinks, but there is the opportunity to ask questions during drinks. Everyone will join us, right? And in a more casual environment, we can have a chat about some of the research that's going on. So again, thank you all. Thank you very much for being here. Thank you very much for joining us. I hope you now have an appreciation for what the centre does, and we look forward to working with you in whatever way we can to collaborate and move oral health forward. Thank you.